So the idea behind doing this study came because most of the studies that were done before in T-cell acute lymphoblastic leukemia or lymphoma, it's either usually combined with B-cell, or they are usually done in the pediatric population only, or they are from general population as a whole based on sheer database. Our population was unique in a sense that I work in Bronx, in a hospital in Bronx, so we have a lot of patients who are minority, either they are Hispanic or they are Black, so we don't have a specific data based on this population only. So we decided, why not just take a look at this specific population, because this is a unique population with unique challenges, right? So that's why we did a retrospective study based on the patients with T-cell ALL who were followed up at Montefiore Medical Center. So we looked at the genetic, the immunophenotype of the patient, the sex, age, ethnicity, and race of these patients, and we're trying to figure out how it affects the overall survival of these patients. So like I said, it was basically a retrospective single-center study. We looked at patients from 2004 to 2012, I believe. We had a total of 59 patients, which, given the paucity of data we have in this particular field, it's still a pretty good sample size. Out of those 59 patients, more than 50% of those patients were ethnic minority, including Hispanic and Black population. So when we did the survival analysis, we initially did the univariate analysis looking at age, sex, race, and ethnicity, and also immunophenotype. Except for the ethnicity, which is Hispanic and non-Hispanic, we did not find any difference in the survival between any of the other factors. So there was no difference between male and female, no difference in between Black, white, or other kind of races, no difference between the immunophenotype, which we basically divided into ETP-ALL versus non-ETP-ALL. So we figured out that Hispanic patients overall are at higher risk of mortality with this particular type of ALL. But we also wanted to remove the confounding factor of age, so that's why we did a multivariate analysis taking age into account. But even with the multivariate analysis, we found that the overall survival for Hispanic patients was worse than for the non-Hispanic patients with a higher hazard ratio. So that's the main finding of our study. We also looked at how the transplant patients do for this particular type of ALL. And we did not find any difference in the overall survival of the patients who were either transplanted or not transplanted, mostly probably because we didn't have a big sample size, as only 10 of our 59 patients had transplant. But when we looked at the patients who eventually relapsed in the course of their disease, we found out that the patients who got transplanted in their first complete remission, so that's CR1, they did better. They had better overall survival compared to the patients who did not get transplant during their first complete remission, which it's kind of difficult to kind of get a conclusion out of it, but we can at least have a hint that if patients are transplanted early on, especially if they are at a high risk of relapse, then eventually they might have better overall survival. So that was like a side finding of our study. So that's basically our conclusion as well. Hispanic patients, they have worse overall survival, but again, we don't know exactly why. So further studies are needed in that regards. And that's pretty much all. That's what we found out.